Okay. Some calls I see. Oh shit. I be having some ways that let's see. Let's see right. Okay. So I get to have kind of like some liquid too. I might put a little, I saw some little drop of amber. Some water in my rice.
King Center.
Hi, I'm Jasmine Renee Davis. May I have someone speaking with, please? I'm calling to the
What'd you say?
doctor. I'm calling to the Dr. Martin Luther King Jr. Community Center.
Okay.
I'm asking who I'm speaking to.
Jasmine, this is Billy, who you always talk to.
Oh, always win.
Every time you call.
Oh, so I should ask for you every time?
I guess so. You run this to me every time you call here.
Hi, may I speak to Billy?
Yeah.
Billy.
Yes.
I would like to know if I could use an electric skillet to warm up some food there.
Oh, see, that the city have a policy against that. You can't do that because when Lakeview got caught on fire, no outside person can use the stuff in here and the stove.
No, my own electric skillet.
Yeah, they won't let you do that. That's what I'm saying.
And so what did you say about the stove?
Well, it's the same thing. They won't let electric appliances in here. You know what I'm saying? Because after the fire, they prohibit all that.
Oh.
If it ain't a staff member, you know what I'm saying? They prohibit any people outside doing.
And so what policy is that? Like, what did they make that into some kind of law? What rules? How did you?
Yeah, well, that's the law after Lakeview got burnt up. The place by the zoo. They stopped all that. They put that into place that nobody in Alphalka can use any electrics. Nobody can use nothing electrical like that. A heating thing to heat up anything.
Okay, and you said the city that they made that a rule. They have that.
Yeah.
Okay.
Yeah.
Okay. Just asking.
Yeah, that's Park and Rec rule. You know what I'm saying?
Do you all have anything? Did anybody ever suggest that they would teach the skills so that people won't start fires or some kind of community economics?
We don't have to get into that. You know what I'm saying? We don't have to give no class for that. You know what I'm saying? They don't have to give no class for that. This is just their policy.
No, I'm not saying to reform or to change, but I was just saying, just in case it's some kind of community element. Like I know at times where people will rent the building, they can
yeah, but see, when they rent the building, what they have to do, they have to have their stuff catered in here. You know what I'm saying? That's what they have to do. They have to have it catered.
So they couldn't warm anything there anymore.
You're right. They have to have it catered.
Oh, I see. Okay.
Mm-hmm. So that's the way they have to do it. If they come over here and rent it, you know what I'm saying, repast stuff, their stuff had to be catered in here.
Or some sort of corporate conference or some sort of event or something, pageant or something like that.
Yeah, there's already heated up coming here to them, you know what I'm saying?
Okay. Well, live, let live, I suppose. I'm just asking a question. So. I would like to live my life and, it's important to have that documentation and information. If some people don't know, that's why they go to a community center to kind of learn how to live and be, at times. So, okay.
Yeah.
So, I might see you all sometime today.
Okay, then.
Appreciate the information.
All right.
So, that's that. Now. I was about to warm up my rice and my jalapenos. I was about to warm up my beans. Onion. I didn't take a picture of my urine. And I had started looking at something too. A little bit. I was actually just probably trying to get through some things. Wow. Eat this though. Not that spicy. I didn't put any additional salt or anything in it this time other than water. Okay. I have to get a number here. Actually, I'm gonna do this.
Experiencing large call volumes due to Medicaid Purchase Plan, known as MAPP or MAP, premiums being reinstated. We appreciate your patience as wait times may be longer than usual.
They're receiving the same amount of calls that they've been receiving. They're supposed to receive. How many
Members
people
who
that
are
they have on
enrolled
there?
through MAP
People
will
living.
need
They
to
not.
pay
You're not just
premiums
about to
again.
drop people off.
You
No more.
should have received a letter in early June if this applies to you. You may also have received a premium statement in mid-July.
No
If you have mailed in your payment, please allow 7 business days for the payment to be reflected in your account on the Access website or My Access app. If you would like to make a premium payment by credit or debit card, you need to do this on the access.wi.gov website or using the My Access Wisconsin smartphone app. If you would like assistance with processing your e-payment, please hold for an agent. If you are new to the MAP program, coordination with your county agency is required for your first payment. For all other inquiries regarding MAP, please refer to the letter you received regarding the reinstatement of your premiums. In this letter, you will find the contact information for your local county benefits agency, and they can assist you with your questions.
I don't know anything about them. I don't know their language.
For English, press 1. Para español, oprima 2.
Because I know better.
If you have questions about your food share household information, approved amounts, or renewal, please contact your consortium for these changes. If you press option 4, it will provide you the number to your local consortium. Thank you. Information about Wisconsin Badger Care Plus, Medicaid, and Food Share Program, how to apply and benefits can be found on dhs.wisconsin.gov/forward/health. Again, the address is dhs.wisconsin.gov/forward/health. If you are calling about the Food Share Program, press 1. To hear health care benefit information, press 2. For SSI payment information or to receive an income verification request, press 3. For consortium information, press 4. If you need help with Access or the Access mobile application, press 5. If you've received a letter from the Wisconsin Department of Health Services requesting information for other health insurance that pays for some or all of your prescription drugs, press 6. For all other information, press 7. If you are calling to inquire if a specific service is covered, please contact your provider. To repeat this information, press 1. To return to the previous menu, press 2. To speak to a member services representative, press 3. Your call requires assistance. Please press 0 to speak to a correspondent. Please wait on the line for a correspondent. Thank you for calling Wisconsin Forward Health Member Services. You can afford to quit smoking. Forward Health covers it. Forward Health covers medications to help quit using tobacco for Badger Care Plus, Medicaid, and senior care members, and covers counseling to help quit using tobacco for Badger Care Plus and Medicaid members. For more information about these services, you should consult with your doctor or HMO care coordinator. Another free 24/7 resource available to help you quit is the Wisconsin Tobacco Quit Line at 800-QUIT-NOW, also known as 800-784-8669. Again, the Wisconsin Tobacco Quit Line phone number is 800-QUIT-NOW. A representative will be with you shortly. Thank you for calling.
In order to ensure accuracy and quality of information, this call may be monitored or recorded. Please hold. Your call will be answered in the order in which it was received. Access is available 24 hours a day, 7 days a week. You can use Access to apply and renew your benefits, report changes, and complete your 6-month report form. The website for Access is access.wisconsin.gov. That is access.wisconsin.gov. Please hold. Your call will be answered in the order in which it was received. Access is available 24 hours a day, 7 days a week. You can use Access to apply and renew your benefits, report changes, and complete your 6-month report form. The website for Access is access.wisconsin.gov. That is access.wisconsin.gov. Your call is important to us. Please stay on the line, and our next available customer service representative will assist you. Your call is important to us. Please stay on the line, and our next available customer service representative will assist you. Your call is important to us. Please stay on the line, and our next available customer service representative will assist you.
What else? That's it. That's enough, I suppose. How many nights see you? Whoa.
Thank you for calling Member Services. My name is Haley. Can I please have your member ID, your case number, or your social security number?
I have a question. I'm Jasmine Renee Davis, and how do you spell your name? I'm just asking because I'm writing this down, but I have some questions actually.
So my spelling for Haley is Hailey.
Okay. So now you asked me to tell you different numbers or like to identify in different ways, right? Like is there a reason, like if I tell you one, would it be a specific thing, or if I tell you something else? What exactly or you know what, that's not even it. But what exactly would it be? Like if I told you just like my member identification number, or what difference would it be if I tell you my social security number or case number? Like what?
So there actually isn't a difference. It's just those are one of the 3 pieces of information that we can pull you up with. If you find that one information is easier to find, like if you can pull up your member ID easier than you can pull up your social, that's perfect. It makes no difference on how we search you up, which item you give us.
And so what's the third one, the case number?
Oh, yes, it is a member ID, case number, or a social security number.
Okay, and what case number specifically are you asking about?
So a CARES case number. It was given to you when you first enrolled within Medicaid.
How do you spell CARES?
CARES, CARES.
CARES case number. And what is that?
So CARES is the system that we use to help with enrolling in benefits. So like when you first called Medicaid and when you first called the consortium and enrolled within Medicaid, that is the system that we entered your information into. The system is called CARES.
And what does that stand for, CARES? What does CARES mean?
Let me verify what it stands for. Just 1 second. Just bear with me. Let me find out what the acronym stands for.
Go ahead
and
okay? Get that information that you said. Go
Okay.
ahead, please. You said, go ahead and get your information. I'm here on the phone. I can hold the phone.
Okay, I'm going to place you on hold.
You can place the call on hold.
Thank you so much for holding. So actually, I am not aware of that. I did ask the supervisor what it stands for, and while I'm waiting for that answer, I'm going to help you out with more questions, okay?
Yeah. So that supervisor did not know exactly what to tell you also?
Oh, no, they're looking into the answer. It's not a system that we mainly use. It's what we link with the consortium. So we just know it as CARES, and it's a system that we use to verify with case numbers if needed. So it's not a main system for us. That's why we don't have a lot of information on what it stands for.
So when did you learn about the system being called CARES, and how long have you been using, what's the amount of time that you've been using, knowing this and not knowing what it means?
So we have been using the system. I don't know personally for the call center. I have been using it for about 3 years, and we have been trained on how the system works and what it's used for. It's just I personally do not know the acronym. It's just me personally that doesn't know it.
You said the acronym, but you don't know what the acronym is. Oh, you don't know the acronym. Okay. but you've been taught to use something, but you just don't know all about it. You just know just a specific amount of information.
Oh, no. I know how to use the system. It's just I don't know what the acronym means. And it's just me personally. That's all.
And again, so you don't know all about it, but you've been taught enough information, but you do not know all about what CARES is, right?
So I only have minimal training on CARES because with member services, we don't need to use all of the CARES systems for us to do our jobs efficiently.
What do you mean by that, Haley?
So so we can use only certain parts of the system because with how the system is set up, we don't need to use certain parts of it, so we're not trained on those parts.
And so when I said to you that exactly, you word it however you want to word it, but I told you that you had limited information, that you had restricted information, that you could not identify entirely what CARES mean. You said that you did know.
So yes, we were referring to the acronym. I don't know what the acronym means. But with my training, I am equipped to use the system.
But you have limited access to so do you know how to how do you know how to use the system, but you should say that you only know how to know a specific amount of what is particular. You have a fraction of the information.
Okay, I will correct that statement in my wording with future members.
Well, I'm talking to you now, and so, what about me on this call?
Oh, yeah, so it was just how we were told to tell our members of that, so I will take your feedback and use that for future members.
Now, I'm just having a conversation to ask you, and so, now, as well says, so, now, if I say to you my social security number, I wouldn't want to validate so you can use my social security number, because that is way more serious than broader than just using only for access within your development within your system. I know what I'm saying. Within your system. But if I was to utilize my social security number opposed to using a case number or some particular member ID number, then it will open up more doors than in other places. And so I want to be careful when I say my social security number, because I'm not giving you all permission to make other choices, but I am calling for a particular reason. So I want to make sure that I get the information that I called about and I can keep going. So I have a social security number. I don't know, and actually I'm gonna look into this. I probably have. I just need to verify, and because I have this case number, but I don't know if that's even the right number. And I said, oh, you know what? That's not for this. This is something totally different. I do not have a membership card at all to even have this number. And I don't know the number in particular, but I know I have the case number. And I just had to grab it from the book that I have, actually. Oh my goodness. Okay, so it's in here. I just have to locate this information. I can just say to you my social security number at this time. That's only because I can find it, but I would probably have to look through 900 pages.
Oh, I'm sorry, ma'am. I'm unable to hear you. Are you still there?
Yes, I am. What's the problem that you said you're unable to hear me?
Oh, yeah. It sounded that you were far away for a second, and I just couldn't hear you.
Yeah, I was.
I can hear you now.
I was actually. I was away from my phone, and I was just saying that I would just tell you my social security number because I do not have that case member ID number. In particular, I would have to go through 900 pages to access it. And I don't know what you mean by CARES case number. Okay.
Okay.
So, my social security number is. And so, how would you use this number once I say my social security number to you, actually?
So we're going to search it up in our verification system, and it's going to populate your Medicaid benefits. Then I'll ask for your first and last name and date of birth to verify your identity.
When you say we're, what do you mean by we're? Like, who would that we're? What do you mean we're? What is that? What is we're?
Oh, I say we as like the call center, our systems. Like in case you speak to another agent in the future, that's how we would use it.
Well, that's what your job calls for. Is that true?
Yes.
Okay. So I can tell you my social security number, and I would ask that you only use it for these specific purposes of accessing my account. Mm-hmm. And then from there, I would ask you to tell me the member ID number and the CARES case number as well. Okay. Once I tell you my social security number to validate those things. And that way I won't have to tell you my social security number. You agree before I even said my full sentence. Okay, so then I won't have to tell you my social security number if I don't want to. Yes. I am. Are you still there? I am capable of confirming my name and full date of birth. So my date of birth, my name. Yeah, I know how to do that.
Okay. Yep. So I just need you to tell me your first and last name and full date of birth.
Oh, so you're asking me to tell that to you?
Yes.
Okay. I'm Jasmine Renee Davis. My date of birth is June 12th, 1986.
Perfect. And now I can answer any questions that you need help with.
I had asked a question.
I'm sorry about that.
That's right. I asked, that's actually good information, but I already asked 2 questions already for you to answer.
So, yep, I can help with unrelated Medicaid questions as well, but if you wanted more access to your account information, that's what we needed to verify. That's what I need.
What is unrelated Medicaid questions?
Yep, so you were like asking what a CARES number was. You can, or like information that's not related to Medicaid. So you can ask for like what the consortium number is. If you want to know like what doctors are provided with Forward Health, I can provide you with information off our public website, stuff like that.
But I asked you to tell me the member ID number and also the CARES case number.
Yep, and I can do that after I verified you.
You did. You just said you did. What else do you need to ask me?
Oh, no, I can give you that information when you're ready.
Tell it to me, please, Haley.
Yep, so your member ID is 340-531-7134. That is your member ID. And then I can give you the case number when you are ready as well.
And so that's the member identification number, right?
Mm-hmm. The first one I give you is the member ID, yes.
And what is that CARES case number?
It is 012-164-5100.
Okay, and so where can that CARES case number be used at? What in particular can I use? Where is that coming from?
So that is coming from the, so it's typically used to identify you in Access. If you ever want to create a My Access account, that is how you pull up your account. I can go ahead, if you're interested in that, I can walk you through how to do that if you're interested.
No, what is Access though?
Oh, so Access is our digital platform where you can do renewals and view your benefit information. So like if you have food share, you can show your status there, and then your Medicaid status can also be presented. And like I stated, if any renewal information is needed from you, it can be completed there as well.
Okay, and so now, and that's called a CARES case number is what you're saying, right? And you all are getting that information to figure out what CARES means. Can you check back in and see?
I haven't gotten a response yet. At this time, I'm sorry about that. Our supervisors are helping other agents with their high call volume.
You just said that they were looking it up.
Yep, and they are. It's just I got a request put in, and they're helping other agents at this time. So I'm still waiting for a response.
And so what happens once you get that and I'm not on the phone? Then how would I get that information from you all?
So you could just call us back and refer to this call. You could say, hey, I spoke with the agent Haley, and she was looking for what CARES means, and she didn't get a reply back for when I was on the call. I was hoping that you guys could answer that or follow up with that.
Oh, yeah, I don't need to include you in my next call. If you're not going to handle it now, then there's no need of me keep putting for what? You're not my particular agent. You're not the agent of mine.
I was just referring to if you wanted to ask the agent, you had said if you wanted to see how to follow up with the CARES information. I was just saying you could bring up the last call. The best way that they can find you is by bringing up the last agent you spoke with.
I'm not interested in that route. I can figure it out on my own. I can ask just as well as I ask. So that's just me calling and asking just as well as I ask you. So why would I have to bring you into that conversation?
So you had just asked how to get that best information. So
I have a call. If you could hold the phone, or whatever, I call back.
Okay, I'll let you know.
Okay, I'm here. You said that you can only hold for 2 minutes. But anyway, that was probably about 20 seconds or something like that. But okay. So now I would ask that you tell me the information of what is the information that you're seeing on my account. What programs do you all have me in? What insurances? What do you have attached to my name in your account? What are you seeing there for my name, Jasmine Renee Davis?
I currently see that you are on the Badger Care program with Medicaid. So that
hold on. Wait, I want to write this down. I'm writing this down. I'm writing it down, and I don't want my handwriting to look all sloppy or not. I want to be able to read what I'm writing, okay? So you said the Badger Care Medicaid program.
Mm-hmm.
I don't know exactly what that is.
You have coverage with 2 places. So you have an HMO on file with Anthem Blue Cross Blue Shield.
Hold on. How do you spell Anthem Blue Cross Blue Shield?
That is, Anthem is spelled ANTHEM.
Okay. And so it's Anthem BLUECROSS BLUESHIELD. How do you spell shield? SHIELD. I don't know how to spell all the time.
That's correct. You got it right.
I don't know. So, I was just kind of looking at what this Blue Cross and Blue Shield means. And this is some serious stuff.
They cover your medical, mental health, vision, and dental. And let me know when you're done writing that down, because I do have some more information I see.
I wrote it down. What do you have to say, Haley?
Okay. So the next part is that Forward Health is covering your chiropractics and prescriptions as well. And that's who you're speaking with today is Forward Health.
Forward Health covers. How do you spell chiropractics?
Chiropractic is CHIROPRACTIC.
Chiropractic. Not chiropractic, so it's singular, not plural, right?
Chiropractics, yes. I'm sorry, with an S.
It's plural.
Yes, we cover chiropractic prescriptions. Chiropractics.
Chiropractic prescriptions?
Yep, we cover chiropractic. I'm sorry. It's quite a Tuesday for me. So chiropractic services and prescriptions. My apologies.
Chiropractic services and what are prescriptions?
So that would include medications.
That's all prescriptions are to you, is just medications?
So, yep, medications like injections, pills, diabetic supplies, medication, stuff that can be filled at a pharmacy.
So what about things like orthotics or shoes or different things to keep a person active and relying on themselves?
So
supplements and things like that.
Durable medical equipment, that is something Anthem can help you with.
When you all talk about prescriptions, do you know exactly, is that the full, can you just verify what prescriptions you have listed as prescriptions there, the definition completely, please?
Okay, for our full description of prescriptions, our advanced line would be able to help you out with that. They have a full list that I don't have access to, so I can get you over there.
Wait a minute. Okay, can you send the information out to me in writing?
So, what do you need exactly in writing?
I want all the stuff detail of what it all is. What is a prescription? What is chiropractic? What is medical? What is mental health? What is vision? What is dental? I want the information about Anthem Blue Cross and Blue Shield. I want so much information. I have other stuff that I have to ask you as well.
Okay. If you would like a printout of your benefits, that's actually something the advanced line can help you with as well. They can get that requested and sent to you.
Okay. And so what is the phone number and address of Blue Cross and Blue Shield? Anthem Blue Cross and Blue Shield.
Yes, I can give you their phone number. Unfortunately, I do not have an address on file for them, but I definitely got a phone number.
What's the phone number there? And that's
855.
What's the country code?
The country code, you said?
Yes, I asked you the country code, Haley.
Okay, I just wanted to verify. So it's 1-855.
Okay.
690. 7800.
And that's for Anthem Blue Cross and Blue Shield?
Yes.
Is there any other phone number that they have to call them on? Or any other information too?
Not that I see.
And so what phone number is that there? What department is that listing for?
So it is their Anthem Blue Cross Blue Shield customer service phone number. It's their general line.
Customer service. And so, what is a customer?
So that is anybody who is receiving Anthem benefits.
Oh, I don't agree with that. Okay, and so as far as to talk to you all about information, do you send out, I know you said that you can tell me information about what doctors are available or just how to access that information. Do you have can you send that in the mail?
So for how to access doctors and stuff like that, if you would like information for medical doctors, mental health providers, vision, dental, that's with Anthem. For chiropractics and prescriptions, I can request a physical list for you to be mailed to an address of your choosing.
Now, I'm not looking for any particular doctor. I take care of myself, but I just asked the question because I would like to know what you all are putting out there and different things that you are doing, but please put in that request.
Absolutely. What address would you like for that to be sent to?
Do you have any addresses on file there in the computer listed for me? I'm just a yes or no question.
We do, but we have to have have our members confirm them to us to make sure that we have it correct on file.
Oh, sure. Oh. I would like for you to note that it's not that I'm calling looking for a doctor. I'm not calling to look for a doctor. I'm just calling to read on the education that you have. Please include the clinics and include the things that they have as far as what all, when you say provider, include what that means. What is a provider? And what all do these people have because a provider is a serious name it for you all to have me choosing. You all chose Anthem Blue Cross and Blue Shield for me this time. I don't know anything about it, and so I have a problem with that, but I want to be able to call and to speak with these people about that. Do you all have any listings of anything in particular there, as well, like any other specific things that I should be made aware of, that you have information that I should know about?
The only thing that I could think of is our public website that we have. If you ever want to search up a provider on the website, like if you've never have access, if you don't have access to that booklet for some reason, like if you're out of the house and if you just want to confirm, we do have a public website that shows all of the providers that accept Forward Health.
Okay, and then also, you said that you all just cover chiropractic. What is chiropractic services?
So, chiropractic services, I am not a medical professional, so I don't know exactly all of what that would include. But with chiropractic services, if you go to a chiropractor, they usually do adjustments and movements on injuries or backs. With the specific Forward Health coverage, you are able to get 20 chiropractic visits included within the coverage per injury. And if you need more visits than that, your provider, which is the chiropractor, the person who's giving you care, they would submit a prior authorization. If you would like to know more about what chiropractic services are offered, I would definitely recommend having your provider call Provider Services. They can give the provider a list of services that are included with chiropractic.
Okay, so you all should have that information though, to send out so someone can understand. Now, what about self-referrals and things like that?
So self-referrals, you are able to walk into a chiropractor without any type of referring. So prescribing, referring, ordering provider codes is not required for any initial visits. So you can just go ahead and do that self-referral process, no problem.
You said ordering provider codes?
Yes.
What is that?
So that's like a provider ordering that you get chiropractic services. That is that's what that means. I'm sorry.
It's perhaps, that is not exactly what it means, but you summarized it perhaps, Haley? A Forward Health? Ordering provider codes. What codes will those be? What's the name of the codes though?
So that is something that you would need to discuss with your provider. They would be able to give you those different provider codes.
You would know what a provider code is because it has to come to you. It's called a code for a reason.
So I don't have access to those codes.
You don't know what the code.
Providers.
But you don't know what a code is. A provider code is called a provider code for a reason.
Yes, I am not a provider, so I don't have that information.
Okay. And so do you have any other listings or anyone documented? Do you have anyone listed on my account other than myself, whether it is to speak for me, anything like that? Do you have any of those things on my account?
Let me see if I have anybody listed, like a representative or anything like that. Okay. I do not see anybody listed on your account as an authorized representative, POAs, nothing like that. The only thing I see on your account are two, let's see, it says Tyrell and Divine. Are those your children?
What's the name? So
Let's see, it is Divine. That is Divine, and Davis is Davis. Tyrell is Tyrell, and his last name is Morris, Morris.
those are their names, and they are my children. They are children that I gave birth to, that I carried and brought into this world somehow. They're their own people, though.
On the case.
Okay, and so now that means that I'm on their case, and also now when you look at their cases, do you see anyone that is authorized as a representative on their cases?
I do not see anybody listed. Actually, I misspoke. My apologies. For Tyrell, I see Sari Lee.
Okay. Is there anyone else on there?
No. Other than that, Sari Lee.
Yeah, I appreciate that information. Okay, well, that's what I call you about today. My problem is I have to call to Anthem Blue Cross and Blue Shield to get this information that I am actually looking for. I have some questions to ask Anthem Blue Cross and Blue Shield to take care of. And so is there a way you can send me just an itemization of what you see that outlines like my name, the insurance that you have listed for me, the case number, and all those stuff? Can you send me just that so that I can have it in writing?
So that's something our advance line would be able to help you out with. I can get you connected over there.
I can call someone. Do they have a phone number I can call to?
They unfortunately do not have a direct line. They're an internal department that we have to transfer to.
Okay, I can call some other time to forward help to speak to them. I have some other stuff that I need to take care of. But I got the information that in particular that I called about, but these are just some additional questions that I have to kind of like correspond with the reason for my call. But they are not as urgent or mandatory as me getting the information of Anthem Blue Cross and Blue Shield. And that is an HMO or PPO?
It is an HMO.
And what does HMO mean?
Health Managed Organization.
Okay, health managed. Like, how do you spell that?
So managed is spelled MANGED.
Okay, managed organization.
Mm-hmm.
And what does that mean? Health managed organization.
So a health managed organization, so it is a network of doctors and providers in a concentrated area as opposed to them being more widespread throughout the state.
And what is that concentrated area, please? Can you tell me that, Haley? I'm asking you to tell me that.
I unfortunately do not know the concentrated area that Anthem stays in. You would need to ask them that directly.
And is there any additional information that would tell me more about what that you would know about what a health managed organization is? Because you all should have that information. If you all are the ones that are being hired to manage this information and you're supposed to be member services, then you would probably know who you have a contract with.
Yes, so we do have multiple contracts with many health managed organizations. So we actually do have an HMO enrollment line, and they can answer more questions related to HMOs. We are more focused on information with Forward Health and what we can cover. If you have information on what HMOs are best suited for you, or exactly what HMOs are concentrated in what areas and why HMOs are set up the way that they are, the HMO enrollment line would be able to help you out a lot more than I can.
What is the phone number to your HMO enrollment line, please?
It is 800.
It's 1-800, right? Is that a country code of 1? What
Yes.
country code is that?
1-800.
1-800 291
2002.
2002. And so that is for Forward Health's HMO Health Managed Organization enrollment line. And what is a health management organization enrollment line?
I'm sorry, would you mind repeating that question? It had cut out at the beginning.
Sure. What is what is a health managed organization enrollment line? Like, what is that all about?
Okay, so if you do not select an HMO previously and an HMO is automatically selected for you, this is the place that you would call to change your HMO, or if you have questions about other HMOs and what their coverage includes.
Oh, that's all that's about?
Yes, they can help out with answering HMO questions and HMO-related information.
What about information that I have about myself being involved perhaps in any HMO or being put in an HMO for a reason? Because I was told that HMOs actually give less or more coverage. Like somebody said that it gives lesser, somebody said it gives more. And I have learned that the HMOs don't cover and manage is better and they offer less independence than the Title 19.
They would be able to answer more questions related to that because it is more of a case-by-case basis whether or not an HMO is suitable for you. Some find that HMOs provide more coverage while some find that HMOs do not. So it's really a case-by-case basis. I would definitely recommend calling the HMO enrollment line if you have questions whether or not Anthem is the best suited for you or if there may be a better HMO that is suited for your needs.
And so these people kind of oversee sometimes what the development of a person's case or perhaps of that person or what? The health managed organization network or whatever.
They help with the starting of the enrollment process, and if you have any grievances or questions about the HMO in the future, you can, and if the HMO directly is not able to help you, you can go to the HMO enrollment line.
So you were referring to the HMO enrollment line, so opposed to what I was asking about what a health managed organization does. So I can call and get the information from these people. Anthem, Blue Cross Blue Shield. Do you have any information to send out about this HMO?
I do not have any information to send with that. If you would like information regarding Anthem, I would recommend talking to Anthem directly. They would be able to send any information related to them.
Right, and so you all don't have that information. Now, as far as with you all, can you explain to me what Title 19 is?
Title 19 just refers to being HMO exempt. It means that Forward Health would be fully covering you. Forward Health would cover your medical, mental health, vision, dental, chiropractics, and prescriptions.
Can you send me out information on what all you cover through a Title 19? And
that is something our advance line would be able to help you out with as well. I do not have access to send that information. That's with them.
And then you all have specific limits on how much care somebody can particularly get. Like you you tell them whether or not they can be covered or what can be covered or whatever the situation is. If someone, so are as Forward Health, what is Forward Health? Like, what are you? What is Forward Health?
So we are an insurance company. We are the state's Medicaid. So we are Wisconsin Medicaid. We're essentially an insurance company. So you can call us about whether or not you're wanting to confirm if a provider is within network, if a service is covered. You can call us to see if a bill went through or not. We can help with prior authorization statuses, that kind of stuff.
Now, is Forward Health, who created Forward Health?
That would be the state of Wisconsin, the government of Wisconsin.
The government of Wisconsin. What government is that?
The state government.
But there's different kinds of governments in Wisconsin. There's not only one government in Wisconsin.
So Medicaid is state government insurance.
And so
it's the state that created, it's the state's government.
So are you saying that, is this the public, actually, who created this? Or do you all have a contract? Or did the state of Wisconsin actually come up with Forward Health, and this is all about the state of Wisconsin?
Yes, the state of Wisconsin came up with Forward Health.
Oh, really? And so you are owned by the state of Wisconsin. Your company is owned. This insurance company is owned by the state of Wisconsin.
Yes, that is correct.
Okay, because I've gotten some different information that you all do not work for the state of Wisconsin. That you are contracted.
No, we are Wisconsin State Medicaid.
Okay, and how do you validate that information? What department would I talk to validate that information?
That would be something our advance line can help you out with as well.
Okay, so I have some other questions, but at this time, Haley, I appreciate the information, and I plan to call you all some other time within the next probably 48 hours, okay? I'm Jasmine Renee Davis.
If you have other questions or concerns,
and then, always here to help. You know what? Do you all have a phone number there, an email address for me on file?
Let me see here. I do have a phone number on file. I am not able to see email addresses. I see that the phone number we have is 262-498-6963. Is that the
that is a
phone
number. That's a number that you can call. Can you put more than one phone number on that account?
Yes. However, if you would like to add another phone number, that is done with a consortium who updates case information.
Oh, okay. So I appreciate the information. Calling into Forward Health today. I am Jasmine Renee Davis. Do you have any more questions or any questions that you would like to ask me in particular?
No, ma'am.
Okay, well, I'm Jasmine Renee Davis, not ma'am, but okay. I appreciate the call, okay? I'm Jasmine Renee Davis. Okay.
Thank you for calling Anthem Blue Cross and Blue Shield.
Para continuar en español, diga español o marque 2.
If you're a Medicaid member and would like to chat with a live agent via text message instead of remaining in the automated system, just say text or press 1, and we'll text you at this number to get started. If you are calling about a medical or psychiatric emergency, please hang up and dial 911 or go to the nearest emergency room. And just so you know, calls may be monitored or recorded for quality purposes. You'll have all your plan info in one place and always at your fingertips with our new Sydney Health app. It's easy to get answers to your questions, find a doctor, order an ID card, and so much more. Visit the App Store or Google Play today to download Sydney Health. SYDNEY, or ask a representative for assistance and get the most from your health plan and your health. If you're a relay-assisted caller, press 8 now. Otherwise, are you calling on behalf of a provider, hospital, or pharmacy?
No, I am not.
If you are a physician, hospital, pharmacy, or other healthcare professional, say yes or press 1. Otherwise, say no or press 2. Or if you're
No.
calling on behalf, your opinion matters. If you receive a survey from us, please return it. This helps us to improve your health plan. Your opinion matters. If you receive a survey from Anthem Blue Cross and Blue Shield, please return it. This helps us to improve your health plan. In a few words, please tell me what you're calling about. You can say things like vision, dental, or transportation. You can also say enrollment status or prescriptions. Okay, go ahead.
Now, I have some questions about my account there with you all.
To make sure I get you to the right place, please say one of the following. Please say enrollment status, prescriptions, make a change, talk to a nurse, claims or doctor bills, or something else. If you're in danger of
Make
hurting
a
yourself or
change.
someone else,
Make
press
a
9.
change. Actually,
Just sorry, I didn't understand. I think that was make change.
actually, I want to talk to someone about enrollment status.
All right. To make sure I get you to the right place, please say one of the following. Please say enrollment status, prescription.
Enrollment status. Enrollment status. Be sitting right here handling on my stuff.
Now tell me your member ID, including any letters. You can also enter it, and for any letters, press the corresponding key. For example, for the letters A, B, or C, press 2. If you need a moment to locate it, just say 1 moment.
340-531-7134.
Thanks. What is your date of birth?
June 12, 1986.
Got it. Thanks. And what is your 5-digit home zip code?
I don't even know what you are. Probably 53140.
I didn't understand. Say or enter your 5-digit home zip code.
Maybe 53144 if that's what you have, but it's probably is for the Workforce
Thanks.
Development Center. Oh, 53144 is what they have.
Sure. Enrollment status. Please hold while I transfer you.
The call.
Your call will be answered momentarily. Please stay on the line, and a representative will assist you shortly. May is Asthma and Allergy Awareness Month. Asthma can cause coughing attacks, chest tightness, and wheezing. Here are the best ways to help manage your asthma. Learn how to use inhalers by asking a nurse or doctor or watching videos. Take controller medicines every day and keep rescue inhalers with you at all times. Get refills on time. Thank you for calling. My name is
Oh, what's your name?
Shakana,
Oh, how do you spell that?
Shakana.
Okay, I'm not really hearing you as much here. Are
Can you
you?
hear me now?
I can hear you talk, but I'm trying to understand exactly what you're saying. I know you're saying something, but can you say whatever you're saying? For how do you spell your name?
Shatana.
Okay, so Shatana.
Correct.
Okay, I don't know if you said Shakana or what. Okay, and so I'm Jasmine Renee Davis. And what department am I speaking to right now? Like, where are you? What's the location of where I've called this phone call have been transferred to?
We're speaking with member and provider services.
Okay. And so, for what company?
You've reached Anthem. Do you have a policy with us?
Anthem who?
Health insurance.
Oh, that's the name of it? Anthem Health Insurance?
Correct.
Hmm.
Where are you trying to reach?
You said that your company is called Anthem Health Insurance.
You have reached the health insurance. Correct. Called Anthem.
And is there any other names with just, is it, what other names is attached with Anthem?
That's the only name that we have.
Okay, so Anthem is separate than Blue Cross and Blue Shield then, right?
It would be, it's a Blue Cross Blue Shield company, but we are Anthem, yes. Hello?
I'm writing this information down here. Is there a reason why you're saying hello?
Because I did not hear anything. Do you have a policy with us? How can I help you today?
What exactly do you mean by policy?
Do you have an insurance policy with us?
There is through an HMO perhaps, but I don't have the information on the policy, and I will be asking you today to send me the information on that policy. I did verify my member ID before even calling this phone number. So did it not transfer to you? Do you not have that?
No, I do not have that. Can you provide that member ID to me?
I can tell you that member ID number perhaps is 340-531-7134.
Okay, and I caught your first name. Can you verify your last name?
I am Jasmine. No, I keep my name. I'm Jasmine Renee Davis, June 12, 1986.
What's your best contact number?
What kind of number are you asking me about?
Your phone number.
1262-498-6963.
And can you verify your address as well?
What address are you asking me?
I'm asking if you can verify your address.
What address?
That you have on file with us.
There could be an email address, a physical address, a mailing address. There are addresses.
Your mailing address.
I did ask one question already, and I asked that you send me out the full description of the policy that I have there with you all at Anthem Blue Cross and Blue Shield.
Do you need a member ID as well? Or just the member information?
What are you asking me? A member ID is what? What is a member?
I'm asking if you need your subscriber ID. What you gave me is your Medicaid number. So did you need your actual subscriber ID with Anthem
that's why,
as well?
and that's why I told you that I did not know if that was the appropriate information. What is that ID number?
It's 733-085-91.
So 733-085-91.
Let me read it back. 733-084-591.
Oh, okay. 4591. Okay, 733-084-591. Okay, so that's an identification number with Anthem Blue Cross and Blue Shield, right?
Correct. Did you need a member ID with that information on it as well?
A member ID? You just told me what is a member ID?
Do you want an ID card, an actual ID card that has that information on it?
No, I don't need that.
Okay. So you just need information regarding your policy then?
Yes. I want the full information to be sent out to me, to that mailing address that I described previously on this call.
Okay, so you'll be receiving the turnaround time. It's 10 business days for you to receive that information by mail.
And can you tell me what you have included? What's all included that I should be getting in the mail, please? And I have other questions.
You'll be getting your member handbook that has information regarding your policy.
No, I want my own individual policy of what that includes, not a generic description. I want to know about my own policy. Things that actually are about me, Jasmine Renee Davis.
So the handbook is going to include that information.
So I'm not asking for I want something that is about me.
If you're looking for something more specific, then you would have to reach out to Medicaid. This is a Medicaid policy.
To Medicaid? How? If someone writes up a policy, they have their own particular policy that is sent. It would have my name, date of birth, policy number, and it would describe the policy.
That would have to come from Medicaid.
And what phone? Medicaid? What's the phone number there?
Allow me just a moment to get their number here.
This is ridiculous.
Okay, that number is 1-800-362-3002.
You all okay? So it's called Medicaid because this is a place that told me that you all have all the information.
So we're an MCO for Medicaid.
What does that mean? What does NCO mean? What does NCO mean?
We're a managed care organization, so we manage the Medicaid that
they determine that you're eligible for.
You're a managed care organization?
Correct.
Oh, so you're not a health managed organization. You're not an HMO, you're an MCO.
Right.
I was told that you're a HMO.
Okay. We're a managed care organization.
And so that's what can you send me out information about that you have me listed on a managed care organization?
So for that would have to also come from Medicaid, as far as them showing which MCO that you're assigned to.
So what information do you have about me there? What I know you are. Who do you have listed as a provider for me, as a doctor for me there?
The primary care provider?
Yes. Who do you have for a primary care provider?
We have a Charles Santaluca.
How do you spell that?
SANTILUKKA.
And what's that? Where's that person at? Do you have anyone else listed as well? Well, I just asked you, Charles Santaluca. And where's this person? Where's this person practice out of? What's the address and phone number, please?
It's 104.
Wait a minute. Wait, you said the number is 104?
00.
10400.
75th Street. And it's in Kenosha.
Kenosha where?
Wisconsin.
What's the zip code, please?
53142.
And what's the name of the facility or the hospital, wherever that person is? Where this is at?
It's Aurora Health Center.
And so when do you have listed that this person became my primary care provider?
We're showing the most recent effective date, April 1st of this year.
So that's when that person, no, I said when did that person start being, not the most recent date, but when have this person been listed as my primary care provider?
September 1st of 22.
Of 22? What does 22 mean?
The year 2022. September 1st of 2022.
Do you have a phone number there at that office, please?
262-652-3500.
And who else do you have listed as a care provider on my account?
That's we only show the primary care provider, so we only see this particular provider listed.
And who was that care provider prior to Charles Santaluca?
We don't have anyone listed before that date.
Okay, and this person has to be taken off my account. I do not have a primary care provider. Please take that person off of my account. I do not know that person. I have never seen this person. Do you have medical records that I can request for this about this person as well? What do you show?
Request to access records.
From you or from this managed care organization?
Correct.
Okay, I would like to do that. May I please request? Can you tell me how to request those records?
I'm submitting that request now.
And can they be mailed out to my to that mailing address, please, physically, or can you send by email? I would prefer
it would have to be
physical.
Yeah, it would have to be mailed to the address.
Please, can you please send those out to me?
Okay, so it's the same turnaround time.
About what is the turnaround time?
10 business days.
Did you also send out that? Are you still sending out that handbook that you said to me, Shatana?
Correct.
Okay, I appreciate that. Now, what is to access the records? What all would that include?
That would include medical records. Any medical records.
And so now, is it all medical records? Because that's one reason for my call. I want to request all the records that you have about me.
So you're wanting to request records from when you first went into effect with us back in September of 2022. So any records from any provider. Is that correct?
Yes. But also in particular from this Charles Santa Luca as well.
Okay. So that request has been submitted for all records for all providers.
And so there would be no change. Once you have submitted it, it's validated. No matter what changes I make, that stuff will be still sent out to me, right? Because I'm not going to cancel it.
Correct.
Can you send me confirmation of that, please?
We don't have a way of sending. What I can do, I can give you a reference number for the call, but we don't have a way of sending confirmation for information requested to you.
Okay, what is the reference number for the call?
It'll be under I-217-222-661.
And now, how do you spell I? What is I?
I is an igloo.
Okay, I appreciate that information. And then so that's how I can access the call, and that's just a number to identify the call, right? Is that true? Is that what that is?
Right.
That reference number?
Correct.
Okay. There's a portal that you all have that I can go online and look at my records and different things and who's all listed there. Is that true?
Correct. The Sydney Health app.
Okay, Sydney Health app. And how do I sign up for that or something like that? What can I do to access that?
You would have to download the app.
Okay.
And then you would register.
And how would I?
Member ID number.
And then what other information would I have to have? Can you see if one has been already accessed for me in case I have to reset it?
So for that, I would not be able to check on my end, but I can get you to web support. They would be able to see if you have an active account.
What's the phone number for that web support there?
Eight 755-2680.
26. So is that country code 1-866-755-2670? What country code would that be?
It's 866-755-2680.
Oh, 2680. Okay. And what is the country code there?
We don't have a country code for that number.
There's always a country code.
That's the only number that's what I'm showing. What I gave to you.
What is it? What country is it in? What country is it in? What country is this phone number located in?
It's in the U.S.
U.S. of what?
The United States of America.
Okay. Now, to these primary care, there was some other listed on my account previously. Can you tell me who that was? A previous primary care provider that was listed previously?
We only have the one on file for you.
Okay. And so what is the importance of you having a primary care provider listed for me?
That's the provider that you were assigned to see for primary care.
Who assigned that to me?
And it would have been assigned automatically if you had not chosen one.
I do not know this. No, I would like to actually take that. I don't take that person. Please, can you take that person off of my account? I don't know that person. I do not want that person on my account.
Okay, so we wouldn't be able to change it unless we assign you to a different provider. Do you have a different
You can be
provider that
sued.
you want to be assigned to?
No. You can be sued. You don't have somebody to make choices for my life and force me into something. This is not how this is going to work. You all do not force me to speak with anybody or to meet with anybody. I do not have to have a primary care provider.
Okay, well, do you want to? So
I am my primary care provider.
Account unless I change it to someone else.
Jasmine Renee Davis.
Hello?
Yes, I told you. I take care of myself. Do you all have any holistic doctors that you all have there?
Yes, there's other providers. You can locate those providers within the Sydney Health app as well.
No, but I don't have that app, so I'm asking you.
You can also go to the website.
I don't have access to that website to print that information out. I do not have a computer. I asked you, can you tell me, do you have natural and holistic, natural doctors there? This bitch hung up the motherfucking phone. And if she didn't hang it up, what the fuck happened? But I don't know that person, Charles San Luca.
Thank you for calling Healthcare in Kenosha on 35th Street. If you feel this is a medical emergency, please hang up and dial 911. If you are calling for a medication refill, please contact your pharmacy directly. The pharmacy will fax your request to your physician's office. Please allow 24 to 48 hours for your medication refill to be processed. Our fax number is 262-997-0113. All of our team members are currently assisting other callers. Please remain on the line and your call will be answered in the order it was received. Thank you and have a great day.
They don't even have the proper information. This is so much. Yes. Some juice, some fruit juice.
All of our team members are still busy. Please remain on the line and your call will be answered in the order it was received. If you wish, you may leave a voicemail message for our office by pressing 1 at this time. Thank you for your continued patience. Thank you for calling Aurora. How can I help you?
Hi, I'm calling to ask some questions about some appointments. Charles Santaluca.
Okay.
Can you verify those some previous appointments or any records that I have? I'm Jasmine Renee Davis. And what's your name?
Give me just 1 second. I do apologize. What is your phone number, please?
Why are you asking me that?
I'm sorry?
Why are you asking me my phone number?
So I can look up your information.
Oh, it wouldn't be by my phone number because I'm sure that you all don't have a recent phone number, but you probably have another number, perhaps.
Okay. And what is your last name again?
My name is Jasmine Renee Davis, Davis.
And your date of birth, please.
June 12, 1986. And what's your name?
My name is Cindy.
Cindy, how do you spell that?
S as in Sam, I-N-D-Y.
Okay.
Okay, and I need to verify some more information. May I please have your address?
I can tell you that you probably would have I don't know if you have a particular address. I haven't updated any information with you all, actually.
Okay, do you want to go ahead and do that now so we have the correct information in your chart?
What do you have? What address do you have there?
Until I'm able to verify.
Okay, you can ask other questions. I can answer anything about me.
Let's see here. Do you know the old phone number that you had?
Yes, 1262.
Buchanan Street.
Oh, okay, that's a mailing address.
Okay. All right. And what is the new address?
You can keep that address on there.
Oh, okay. Sure, no problem. I'll do that. And you wanted to know what appointments you have coming up, right?
I want to know about all the appointments, the previous dates and the current ones as well.
The previous dates. Okay, so for the previous ones, let me see here, like all of them?
Yes, please.
From one particular doctor or all the doctors?
So you have Charles Santaluca. I'm referring to Charles Santaluca.
Here. Okay, I don't see any past, prior, or future appointments with Dr. Santaluca.
Okay, but you all have him listed as my primary care physician.
I actually don't see that in your chart anywhere. I don't see that he's listed as your primary care at all.
He is not. I don't know anything about him, but it is being said that he is. So someone is doing something behind my back and not notating and documenting it properly.
And who advised you that Dr. Santaluca is your primary care provider? Was that your insurance?
Anthem Blue Cross and Blue Shield did.
Okay. So they assign that to you automatically. We don't do that.
It does not matter. I still won't validate him. He cannot. I tried to actually just remove that whole situation. What diagnosis do you all have for me there at your clinic?
I
can't give you that information. I am not a nurse, but like I said, we don't have
That's
you
okay.
down as
There's
a primary care
well, where's a
Dr.
nurse
is a
that I
primary
can
care
talk to?
provider.
Well, a
He's
nurse
not.
can.
He's not attached to you here.
He's
Like you're not a patient at all of his.
and so that's what. But what I'm saying is, it is listed, and they have that there for a reason. It's being used for some specific and particular reason. I would like
Right.
to
You'll
talk
have
to
to
a
talk to your
nurse.
insurance company about that.
That's
we
okay.
have nothing to
Okay,
do
I'm
with
on to
that.
the next question now. I would like to talk to you. Said to talk to a nurse. I would like to talk to a nurse, please.
So because you're not a patient, an established patient, we can't do that.
I have business there.
I'm sorry?
I have business there.
And what business with what doctor?
With the clinic. I have called you all about different things. You all have mailed me letters describing things that have. Do you see a current letter that was mailed out to me from you all?
Let's see. Give me 1 second here.
No.
Not from this office, no.
That is not true. It was a letter mailed out within the last not even 60 days from your office on 35th
Not from
Street.
this office, though. From another office, but
What?
not from this office. I see something from Dr. Naker's office.
Who is Dr.
That's on 22nd Avenue.
When was that sent?
It looks like it was sent May 16th last year.
No, someone just sent something from 35th Street.
Okay. All right. Let's see here. So you did confirm the phone number, you confirmed the address, you confirmed your date of birth. So from my point of view, I have the right chart, and I didn't see any duplicates in here. So I don't, like I said, I don't see anything regarding Dr. Santa Luca in here at all.
I didn't say from Dr. Santa Luca. I said that you all sent something from that office. I told you I don't have anything to do with that person.
Okay. Well, even from 35th Street, I still don't see anything. Let me see here.
Okay,
Hang
can
on,
you
let me
send
go
me
further
a
down
send me a
little bit.
letter? Can you send out a letter verifying that I am not a patient of Dr. Santa Luca, please?
I can't do that. No, I'm sorry.
Oh, well, so, where's your office manager? Don't worry about it because you all have a huge lawsuit. I'm not going to do this. I know that a manager from that office sent me a letter out within 60 days from prior.
Sure.
And
I
you're
can send you
refusing
over
that.
to my
You all give me
supervisor's
such
line.
you all have multiple accounts. You even have an account that is mine under a different date of birth as well with my same phone number. You have all these things.
Which is the 1501 number, the old one?
Don't worry about how old it is, how new it is. It does not matter. You all have accounts.
Well, you're claiming that there is another account. So if I'm looking at the wrong account and you're claiming
What
that you
account
got
do you see there?
mail from our office, it would be reasonable for me to go into that account to look at it.
What's the date of birth you see on that account?
I'm sorry?
About what?
You're claiming that our office sent you a letter,
You
which
did.
I don't see here in this chart. So if you're claiming that there's another account out there, but you're not
It's
confirming
been
the phone number,
validated.
so I can
It's
go ahead
been
and
validated.
look
I've
at
been
that
on the
chart. I
phone with
really
you all.
can't
I
help you.
validate. It's been validated. It's been validated from another one of your office staffs. You have two accounts with my name,
Okay.
okay, with my phone number, my address, and a different date of. You put a different date of birth on it though.
Okay.
So what date of birth do you all have there?
The one that you verified, which was June 12th, 1986?
So there's another account that you all have for Jasmine Renee Davis, and I'm sure you can see that. There's two accounts that you all have.
Here. Let's see. Give me 1 second. With the same date of birth? Or you said different date of birth, right?
I said a different date of birth.
So it looks like the name Jasmine Davis is a common name. So I have multiple Jasmine Davises here, but, different accounts. But doesn't necessarily mean they're all you.
No, I told you that this was with my phone number and my name. Anyway, I would like to speak to the office manager that you all have there, so I can get my information sent.
Sure. Give me just a second. Let me transfer you to her voicemail, okay? Because she is out of the office right now. Let's see. All right, give me just 1 second.
So who else is there? Who will be taking care of the matters if someone has to speak to someone that's urgent?
for calling Aurora Healthcare in Kenosha on 35th Street. If you feel this is a medical emergency, please hang up and dial 911. If you are calling for a medication refill, please contact your pharmacy directly. The pharmacy will fax your request to your physician's office. Please allow 24 to 48 hours for your medication refill to be processed. Our fax number is 262-997-0113. All of our team members are currently assisting other callers. Please remain on the line and your call will be answered in the order it was received. Thank you and have a great day.
That person's voicemail, she or he should be able to answer the call. Should be an email address or something to reach out to that person so that person can be able to do their job.
All of our team members are still busy. Please remain on the line and your call will be answered in the order it was received. If you wish, you may leave a voicemail message for our office by pressing 1 at this time. Thank you for your continued patience. We are currently experiencing heavy call volume. Please remain on the line and your call will be answered by the next available team member. If you wish, you may leave a voicemail message for our office by pressing 1 at this time.
It's like they automatically assume that I'm going to be upset, or because I'm a black woman or a black person, I'll be upset because they know how they mistreat people and they do things to upset people, disappoint people, harm and abuse people. And because they don't properly talk about these things.
All of our team members are still busy. Please remain on the line and your call will be answered in the order it was received. If you wish, you may leave a voicemail message for our office by pressing 1 at this time. She probably changed that. She changed that date of birth. Thank you for your continued patience. We are currently experiencing heavy call volume. Please remain on the line and your call will be answered by the next available team member. If you wish, you may leave a voicemail message for our office by pressing 1 at this time.
They did send me an email, a letter in the mail and all that shit.
All of our team members are still busy. Please remain on the line and your call will be answered in the order it was received. If you wish, you may leave a voicemail message for our office by pressing 1 at this time. Thank you for your continued patience. We are currently experiencing heavy call volume. Please remain on the line and your call will be answered by the next available team member. If you wish, you may leave a voicemail message for our office by pressing 1 at this time. All of our team members are still busy. Please remain on the line and your call will be answered in the order it was received. If you wish, you may leave a voicemail message for our office by pressing 1 at this time.
Thank you for calling Anthem Blue Cross and Blue Shield.
Para continuar en español, diga español o marque 2.
If you're a Medicaid member and would like to chat with a live agent via text message instead of remaining in the automated system, just say text or press 1, and we'll text you at this number to get started. If you are calling about a medical or psychiatric emergency, please hang up and dial 911 or go to the nearest emergency room. And just so you know, calls may be monitored or recorded for quality purposes. You'll have all your plan info in one place and always at your fingertips with our new Sydney Health app. It's easy to get answers to your questions, find a doctor, order an ID card, and so much more. Visit the App Store or Google Play today to download Sydney Health. SYDNEY, or ask a representative for assistance and get the most from your health plan and your health. If you're a relay-assisted caller, press 8 now. Otherwise, are you calling on behalf of a provider, hospital, or pharmacy?
No.
If you are a physician, hospital, pharmacy, or other healthcare professional, say yes or press 1. Otherwise, say no or press 2. Or if you're calling on behalf of a member using a text or TTY telephone, press 8. Your opinion matters. If you receive a survey from us, please return it. This helps us to improve your health plan. Your opinion matters. If you receive a survey from Anthem Blue Cross and Blue Shield, please return it. This helps us to improve your health plan. In a few words, please tell me what you're calling about. You can say things like vision, dental, or transportation. You can also say enrollment status or prescriptions.
Enrollment status.
To make sure I get you to the right place, please say one of the following. Please say enrollment status, prescriptions, make a change, talk to a nurse, claims or doctor bills.
Enrollment status. Enrollment status.
I didn't get that. For additional enrollment information, say enrollment status or press 1. For questions,
Press 1.
now tell me your member ID, including any letters. You can also enter it, and for any letters, press the corresponding key. For example, for the letters A, B, or C. Thanks. What is your date of birth?
June 12, 1986.
Got it. Thanks. And what is your 5-digit home zip code? Thanks. Just to confirm. Was that the correct zip code? Please just say yes or no.
What did you say?
I'm sorry, I couldn't get that. Sure, enrollment status. Please hold while I transfer you. Your call will be answered momentarily. Please stay on the line and a representative will assist you shortly. May is Asthma and Allergy Awareness Month. Asthma can cause coughing attacks, chest tightness, and wheezing. Here are the best ways to help manage your asthma. Learn how to use inhalers by asking the nurse or doctor or watching videos. Take controller medicines every day and keep rescue inhalers with you at all times. Get refills on time so you don't miss a dose. Avoid triggers such as dust, tobacco smoke, or pollen. Make an asthma action plan with your... Thanks for calling. My name is Shatana. How can I help you?
I'm Jasmine Renee Davis, and I'm calling about some information. And I have questions about this policy and the membership and different issues. I have not called you all. I don't know anything about you all, and I have some questions that I want to talk to you all about today.
Sure, I can help. What's your member ID?
The member identification number perhaps is 733-084-591. This bitch is, she see that it's, ain't no motherfucking way she playing on this goddamn phone. This bitch hung up the phone.
Thank you for calling Anthem Blue Cross and Blue Shield.
They discriminating. This is a crime. They on some bullshit. Don't worry about it though. Don't worry.
If you're a Medicaid member and would like to chat with a live agent via text message instead of remaining in the automated system, just Just say text or press 1, and we'll text you at this number to get started.
Fuck, you haven't heard answer the motherfucking phone. Why is that? This is what they like, apparently. They want to see how I'm be. They want to see what's the worst it can get, and never would be murdering.
If you are calling about a medical or psychiatric emergency, please hang up and dial 911 or go to the nearest emergency room. And just so you know, calls may be monitored or recorded for quality purposes. You'll have all your plan info in one place and a link at your fingertips with our new Sydney Health app. It's easy to get answers to your questions, find a doctor, order an ID card, and so much more. Visit the App Store or Google Play today to download Sydney Health. SYDNEY. Or ask a representative for assistance and get the most from your health plan and your health. If you're a relay-assisted caller, press 8 now. Otherwise, are you calling on behalf of a provider, hospital, or pharmacy?
No.
If you are a physician, your opinion matters. If you receive a survey from us, please return it. This helps us to improve your health plan. Your opinion matters. If you receive a survey from Anthem Blue Cross and Blue Shield, please return it. This helps us to improve your health plan. In a few words, please tell me what you're calling about. You can say things like vision, dental, or transportation. You can also say enrollment status.
Enrollments, actually, I want to talk to someone about some changes. What is the fucking enrollment status? That's what I want to know.
For additional enrollment information, say enrollment status or press 1. For questions, now tell me your member ID, including any letters. You can also enter it, and for any letter,
they have all kinds of stuff where they use to identify people and to also like prohibit.
What is your date of birth?
June 12th, 1986.
Just to confirm, that was December 19th, 1986. Is that correct?
No. June 12th, 1986.
Sorry, I didn't understand. I think that was... All right. What is your date of birth? Got it. Thanks. And what is your 5-digit home zip code? Thanks. Just to confirm, here is the zip code that I heard. 53144. Is that correct?
Yes. It's just a zip code that they have on file that has been there.
Was that the correct zip code? Please just say yes or no.
I press 1.
Sure. Enrollment status. Please hold while I transfer you. Your call will be answered momentarily. Thank you for contacting Member Services. This is OCDs. Who do I have the pleasure of speaking with?
Well, this is not a pleasure call, but I am Jasmine Renee Davis.
And can I have a good callback number in case we get disconnected?
I can tell you a phone number. Is that what you're asking? A phone number?
Yes.
Okay.
A good callback number in case we get disconnected.
1262 498 6963. But I'm on my own. I just want to live my own life.
Alrighty. And are we going to be speaking about yourself or somebody else today?
Oh, I'm talking to you all about me.
Perfect. One moment,
Myself,
please.
Jasmine Renee Davis.
Alrighty, and I have your account up. How may I assist you today?
So I'm calling. I have different questions that I would like to talk to you about. But how do you spell your name so I can have it for my records, please?
OCDs. OSSIRIS.
OSSIR. What is it? SS? What is it? OSS.
IRIS.
Oh, okay. Okay. I have some questions about my policy. I would like you all to send that individualized policy to me that includes my name and just all the information about my individual policy.
A member handbook?
No. The policy description that insurances have for a particular person. So for myself only. You know, like if you have like home insurance, car insurance, anything like that, you get a policy. It has your name, it has your information, and it outlines what the policy is about.
Right, so we don't have that. We can send you a member ID card.
Why would you send me a member ID card?
Because that's what your policy, it will have all of your policy information on that.
On a card?
Yes, ma'am. It'll have your member ID number, your Medicaid number, your primary care physician, your the phone number for your dental, for your vision, for pharmacy member services, for everything.
That is not what a policy is, so.
Right, so we don't have a policy, individual policy like letter. If you need something that is, letting it know that you have health insurance through us, that will be directly with Medicaid. They'll be able to send you that letter of benefits.
No, and also, you all have a primary care provider listed for me. Who is that person that you have listed?
Charles Satliyuka.
That person, and I called to that office. That person is not my doctor.
Already, do you have the provider that you do want to see? Do you want me to go ahead and update it?
No, and I just would like it to not have any, and I know that I don't have to have anyone listed until I figure out what I take care of myself. I do not have to have one listed, and I don't want one listed.
So on the account, I can't just take it off. I can change it to a new one, but I can't just take it off on the, and have no primary care physician, unfortunately.
You cannot force me to have a primary care physician. And I know that for a fact. I do not have to have one, and I can choose one.
You don't have to see it. But you don't
no, I do not want anybody claiming my life. I don't have anybody taking care of me, showing me how to live my life, having responsibilities, doing nothing, keeping track of me. That person, I do not know that person, and that person is not going to be listed on my stuff. Now, you all are going to find a huge lawsuit here because I've never chosen that person. I don't know anything about them. And in fact, what address do you have? Where is this person even located?
the address on file. One moment, please. Let me go ahead and pull it up. They are at 1020 35th Street, Kenosha, Washington, 53140.
What is it? Kenosha, Washington.
Yes.
That stuff doesn't even match up with the zip code. So who is a representative of Kenosha, Washington?
I'm sorry?
What country is Kenosha, Washington in?
The United States.
Can you spell Washington so I can make sure? What is it spelling there?
It doesn't give me spelling. It just gives me the WI. I'm so sorry. It's Wisconsin, not Washington. I do apologize about that.
You all had a different address that you just told to me earlier today, and so that perhaps is a more of a likely address. That will probably, but that person in that office, I can't call and talk to them. They won't let me talk to anybody in that office. Tried to leave a voicemail with this office manager, but I found that wouldn't be the best option for me. I want to speak to someone immediately, but I know that you all can put something in the system to say that I do not have a primary care provider.
Let me double check that, but I know we're not able to do that. But just one moment.
Do not speak as if you're not. Speak as if, how do you make, just ask, how do you take someone off of there if I do not want to have a primary care provider listed? You need to hear something. This is my call to you about my situation.
And I understand, but if I know that I can't do it, so I have to ask somebody else to see if we are able to do it in the system.
You are, and this is a serious matter. I don't know that person, and I'm telling you now, I don't agree to have that person. I don't have a primary. I do not have any doctors. I don't have a doctor, and I'm not going to have that person being my doctor.
Right. So let me go ahead and ask to see if we can go ahead and remove it. Okay, one moment, please.
I want to eat some good. Oh my goodness, I want to eat some hot, nice. I want to bake something. I want to eat some hot and nice, and I want some fresh fruit that just drip, like, so I could be like this. That's where I'm at right now. This is who I am today, and this is what I can do for myself. And I know I can. And I know I am.
I do apologize for that hold. I went ahead and asked my lead, and unfortunately, we cannot remove the primary care physician on file. We can look for a new one. You don't have to see this one or another one, but we cannot remove it from the file.
You may not have someone listed on my account to take responsibility for me, and that person is not, and I don't want that person. You're now violating my rights and my wishes.
I can go ahead and submit a complaint for you.
Oh, yes.
We cannot remove the primary care physician
Please.
on file.
And can you send that complaint form out to me as well so I can file one as well, please?
So I will be doing it for, won't be sending a form out, but then you will receive mailing regarding the complaint. Yes,
Okay,
ma'am.
sure. This is an urgent matter.
Yeah. I'm sorry?
Yes, I want to file a complaint.
Great. All righty. So give me 1 second, please.
One, two, three, uno, dos, tres. A, B, C.
Alrighty, so you can go ahead and let me know exactly what you would like me to type on the complaint.
That I do not have a primary care provider. I do not want one listed. I take care of myself, and I do not want anyone being listed that has responsibility of me. I do not know who that person is. I have never met them. I do not share the same views as Aurora Hospital. I do not have the same beliefs. I am not religious. I do not have a religion. I do not share those same beliefs. You all are violating my rights and my wishes and what I have planned for myself. I am in control of my care. I'm in control of my own health. Not you. You do not make choices for me. I make my own choices, and you all are supposed to make sure that those are followed through. You do not choose I did not choose that doctor. I do not have a doctor, and you're not going to have that doctor taking up space in my life. There is no occupancy of a doctor in my life, and it's sure not Charles Santa Luca.
I do apologize. I do have to slow down. I do have to.
Okay. Okay. So go ahead and tell me what I said. What I said. I can repeat everything that I said, though.
1 moment, please. All right, so I have that member does not have a PCP.
No, please refer to me. Wait a minute. No. Wait, stop. Stop. Please do not refer to me as member. My name is Jasmine Renee Davis. This is my complaint that you have to fill out since you have to do it. I'm Jasmine Renee Davis. Do not refer to me as member. I am Jasmine Renee Davis, and you may not take away my identity from me. Please refer to me in that report as Jasmine Renee Davis. JasmineRenee Davis.
All right, so I've changed member to Jasmine Renee Davis. So I did put that you, Jasmine Renee Davis does not want a PCP, does not want.
No, can you also wait? Hold on, wait. What is your name? Osiris? What is it? Osiris?
Yeah.
Osiris. Ossiris. Listen, when you write this stuff, do not abbreviate anything. That's not my personality. That's not what I have to do. That's not what I want. I asked you to make sure you spell everything out. I did not say PCP at all in my statement to you. So that can be identified as anything. This has to be an accurate complaint, and it has to be well knowledgeable and well listed so that they can be comprehended appropriately. Please write out, do not abbreviate, primary care provider, okay? Or any doctor.
What else do you need that?
Okay, you can go ahead and read, but please, I do not want a doctor listed at all on my. I do not have a doctor. I do not see a doctor. You can continue to read what you wrote. Oh my.
And does not want one listed and does not want anyone to take care of herself. Jasmine Renee Davis advised that we are violating our rights as we do not make choices for her.
Is that what you wrote?
What else would you like me to add?
No, you put that I take care of myself. I did not say that. No, you did not put that though. You have to take that off of there. I said that I take care of myself. I do not want them having the responsibility of me. Please put the accurate information there.
I said does not want anyone listed and she takes care of herself.
Did you change that to what you just said now? But that's not what I asked you.
It's already written.
That's not what you wrote. So what kind of language you want to talk? Whatever language you want to talk, that's fine, as long as I can get through this conversation.
I'm sorry, I'm not understanding, ma'am.
What tone are you taking? I asked you to please just write only what I told you to write.
And I am, ma'am. You told me, I'm bringing to you what you told me earlier in the call.
I said to write that I take care, Jasmine Renee Davis, I take care of myself. And I do not want any of those doctors listed or having any responsibility of me. I do not want them to be associated with me at all. I do not have a doctor that I see, and I do not want them taking up space in my life. I do not have a doctor.
Alrighty, I added that.
I am not religious. Aurora does not share the same beliefs as me.
And what was the last sentence? And who doesn't share the same beliefs as you?
Aurora, where this place is listed, Aurora, Advocate Aurora.
Alrighty.
I do not know Charles Santaluca. I have never met Charles Santaluca. Jasmine Renee Davis does not know Charles Santaluca. Jasmine Renee Davis has never met with Charles Santaluca. Charles Santaluca has never touched Jasmine Renee Davis. This is my complaint, and I mean this. This is my life.
Alrighty, what else would you like me to
I have never touched Charles Santaluca.
I added that.
Oh, you did. I didn't say that. I have never seen him. I have never had an appointment with Charles Santaluca. I do not authorize you to automatically force a doctor onto me. I would like that doctor taken off, and I do not want any doctor listed. I have not given permission. I do not consent for you all to have a doctor listed. You may not take away that. You may not take away that from me. Don't occupy my situation with anyone. That's not what you're there for.
What was the last sentence, ma'am?
I do not appreciate you all trying to force me to have a doctor listed, and I do not want that doctor being listed. I do not want it to be listed that I have a doctor and I don't. It is a serious interference in my situation.
Alrighty. And what else would you like me to add?
I also want to push the notice that I take care of myself. I am a person who wants to care about myself. I want to live my life. My wishes are valid. Whatever I want for myself, that is what is supposed to happen for me. I am not I am not in a religion. And I'm not going to be forced into some random religion or population.
Perfect. Anything else?
I do not have any information on the kind of doctor this person is. I do not have any education on the education that this doctor has, or any of you. I do not know anything about what Blue Cross and Blue Shield means. I do not know anything about any of you.
Perfect. Anything else?
I do not appreciate you all telling me that you have to force someone to be listed as a doctor after I told you, no, I do not want that person there. There is no law telling me that I have to have a doctor.
Alrighty.
This person is not qualified to tell me what to do with my life, with my body, with who I am. That person is not my creator.
Perfect.
I do not authorize Blue Cross and Anthem Blue Cross and Blue Shield to make any choices for me. I plan to live my life. That's all I want to do. I do not plan to die. I am not dying. I only want to live. I do not agree with any diagnosis, any disease or anything. I choose to live my life and appreciate who I am and not have to be put in some sort of category.
Alrighty.
What is the policy? I do not know anything about the policies that you all have at Blue Cross and Blue Shield. I do not know anything about you all. And I do not appreciate you all not having the information that I'm supposed to have about Blue Cross and Blue Shield, and you telling me to go somewhere else and ask for information about Blue Cross and Blue Shield. Anthem Blue Cross and Blue Shield. Just write my complaint. Just write my complaint. Just please write my complaint. If you want to talk about anything else, that's fine. Just only write my complaint right now. That's what I'm doing. I already asked you the questions. Now I'm writing a complaint.
Okay. Go ahead.
Please. I got this. I do not appreciate the people that you're telling me to go and ask about Blue Cross, Anthem Blue Cross and Blue Shield, telling me that they do not know to ask you, and you all are telling me to ask them. What are you hiding? That is a question. What are you all hiding? What is it that you want from me? What is it that Anthem Blue Cross and Blue Shield wants from me? What is it that you all are looking? What do you want from me? What is your interest in Jasmine Renee Davis? June 12, 1986. It's my date of birth. Please write that.
What was that date of birth?
It is June 12th, 1986.
Okay.
I do not accept or agree with you all just trying to force me into something that I do not know anything about and that I do not want. That is not a good situation to put anyone in. You do not control my life, my situation, or any choices about my living or my lifestyle. I am not sick. I want to speak about healthy things, not how to become sick. I do not agree with that.
Alrighty.
There is no reason for you all to populate something for me and force me into something. If this conversation has never been discussed, that means that you should not put something in position as if I have agreed to it that has been sitting there for almost 3 years without me knowing. I don't know what this person has been doing. I don't know what this person, when people have called them, when I have been in different, I don't know what conversations that person has ever had about me. That person is not in a leadership position of my life. Aurora is not in a leadership position in my life. I do not agree with the practices of Aurora. Aurora is a place of negligence and malpractice. Put that in the report. Advocate Aurora has been negligent and has been shown malpractice to me personally. I do not appreciate that you all have information that I have made to complain previously about how I have been treated through different healthcare facilities and other places, but yet and still you all are forcing me into situations instead of talking to me, asking me what I would prefer for my own situation. You all have medical records. You have different things that you should already know. Instead, you are choosing to not even talk to me. I don't know who to talk to if I want to go over situations about what I'm asking to validate what you all, the information that you all have for me and all that. I do not know.
All right, then.
I do not eat animal products. I do not eat any animals, anything like that. I do not want any animal based, any of that. I have a specific thing that I have for my own personal self. I appreciate more of a holistic and natural approach. And I know that healing is possible. I'm a person who is a healer for my own self. I am a person that can be healed and is healed and healing. I want to build my own blood. I know that the body can heal itself.
All right, ma'am.
I am the only decision maker in my life. I do not know Blue Cross and Blue Shield. I do not know the interest that you all have in me. And I would like to know. I would like to have that conversation, and I want to know what Blue Cross and Blue Shield represents. What is your background? What are your beliefs? What are your traditions? What do you call in the course of action of life and living? I do not know who to talk to there to inform you all of who I am as a person. I believe that I can do anything that I want to do, that everything that I do in my life, I can live and see and be active on my own through my own strength. And I can make decisions if there's other recommendations for whatever it is. I want to learn how to develop my own body and do the things that I have to do instead of having someone else to push off their artificial practices on me or whatever it is. I am real. And I do not appreciate you all with your forcing me to have to look into something that has nothing to do with me. Or to make it look like I have a relationship with someone that I never have, and I don't even know. For 3 years you have had this listed. I do not appreciate having to call you all and people there at your Anthem Blue Cross and Blue Shield not being professional, hanging up the phone on me more than once, calling and then hanging up the phone again, perhaps. I don't know. More than one person did it, perhaps the same person. I don't know. I don't appreciate that either. I want to be able to call and be professional and be myself on the call. And I would like for you all to be professional and ethical in those situations as well. And in this report, whether or not I choose, this is a valid report. Today is active, and this is something that I am going to further on, even if I choose to have Blue Cross and Blue Shield or anyone. I want to know about this whole situation. And that's enough information from now. I want to know, and I'm also telling you, I am my own care provider. I take care of myself. I do not believe in all that stuff. I don't believe in counting calories, and calories are energy. I want my blood pressure to be high. I want to live. I want to continue to increase in my life. I do not want to be on a situation where I am just barely making it. I want my veins to develop. I do not want to live my life to be able to donate my life to others. I need all my own organs. I need all my own body. I need to care for my own self for me. Please write that. Shit.
Yes, ma'am.
I want to see myself as beautiful. I want to grow and develop into a human. I want my hair to grow. I want my body I want to be darker and more healthier. I want to be strong. I want to build my muscle. I want to build my bones. I want to live. I want education. I want literature. What do you all have? Somebody saying you're a managed care organization. Somebody say you're a healthcare organization or health managed organization. What are you? Who are you? I know who, and I am right. I know who I am. I am Jasmine Renee Davis. I'm not trying to be like anybody else. Put that too. I just want to be myself. I believe in myself. I believe in Jasmine Renee Davis.
All right, yes, ma'am. Anything else you would like me to add?
At this time, that will be what I would like to, and I want you to read that. Read what you have written, please.
You want me to start from the beginning?
Yes, I would like you to read what you wrote, please. Make sure you save that, though.
Say what? I'm sorry, ma'am.
What you wrote down.
Oh, yeah, it's going on the complaint. Yes, ma'am.
Okay, please read it.
Alrighty, so Jasmine Renee Davis does not have a primary care physician, does not want one listed, and takes care of herself. She does not want one listed, does not want anyone to take care of herself. Jasmine Renee Davis advised that we are violating her rights as we do not choose for her. She does not want a doctor to take space in her life. She does not have a doctor. She is.
That is not what I wrote. That is not what I said. This is a mess.
That is what you said.
I said that I do not want a doctor to be listed as responsible.
There is no reason why I would add anything on your complaint that you did not say to me.
I said that I don't want a doctor to take space in my life. I said that I do not want a doctor having responsibility, and I do not want that doctor occupying anything in my life. Yes. Why would you summarize what I said?
I didn't summarize anything. I typed it as you said it to me, ma'am.
Go ahead and read what you wrote.
She does not want to take space in her life, does not have a doctor, she is not religious, and Aurora does not share the same beliefs as Jasmine Renee Davis. Jasmine Renee Davis has never met Charles Sataluca. Charles Sataluca has never touched Jasmine Renee Davis. This is Jasmine Renee Davis's complaint and Jasmine Renee Davis's life. She's never seen or had an appointment with Charles Sataluca. Jasmine Renee Davis does not give consent to have a primary care physician listed. Jasmine Renee Davis does not appreciate us listing. I'm so sorry. It's in a small box. Listing a doctor. Jasmine Renee Davis wants to push the notice that take care of herself, and she wants to take care of and live her life. Jasmine Renee Davis, which is are valid. Whatever Jasmine Renee Davis wants for herself is what is supposed to happen for Jasmine Renee Davis. She is not religious and not in a religion. She does not want to be forced into a religion or population. Jasmine Renee Davis does not have any information as to what kind of doctor this is. Jasmine Renee Davis does not know the education of the doctor's education. Jasmine Renee Davis does not know what Anthem Blue Cross Blue Shield means and has no information on any of us. Jasmine Renee Davis does not appreciate us telling that someone must be listed as her doctor after Jasmine Renee Davis has told us she does not want a doctor. There is no law telling Jasmine Renee Davis that she needs a doctor on file. Mm-hmm. This person is not qualified to tell her what to do with her life body. This person is not the creator of Jasmine Renee Davis, does not authorize Anthem Blue Cross Blue Shield to make choices for her. Jasmine Renee Davis plans to live her life. Jasmine Renee Davis does not plan dying. She plans to live in her life. I'm sorry, I just wrote the same thing. She chooses to live her life and not to be put in some sort of category. She does not appreciate to go and ask Anthem Blue Cross Blue Shield what they do not know and then have us go back to, tell her to go back to another place. And what does Anthem Blue Cross Blue Shield want from her? June 12, 1986, she does not accept or agree with us telling her or force her into something she knows nothing about. We do not control her life or living lifestyle. Aurora has shown negligence and malpractice to Jasmine Renee Davis personally. Jasmine Renee Davis does not want to talk about situations and feel validated. What she does not. No? I'm sorry. Jasmine Renee Davis does not eat animals and does not consume any animal products. Jasmine Renee Davis is a healer. She can be healed and is healing. Jasmine Renee Davis wants to build her own blood as only her body can heal itself. Jasmine Renee Davis is the only decision maker in her life. And Anthem Blue Cross Blue Shield, and entities we have on her. Jasmine Renee Davis wants to be herself and believes in Jasmine Renee Davis.
I did not say that only my body can heal myself. I said the body heals itself. My body can heal itself.
As the body can heal itself, right? Not your body, but as the body can heal itself.
My own body, I can't heal my own body. My own body can't heal itself. But there's not to say that there's not something that someone can make that I can see that can heal my body. And that's why I said there are people that do all kinds of things. There's a person I can, and also I would like to make sure that my womb, I would like to have children. I would like to make sure that my womb.
Also going in the complaint, ma'am?
Yes, yes.
So could you please provide that for me again?
I want to make sure that you all know that I plan to keep a healthy body, a healthy womb. I plan to do whatever I want to do with my body to be active. I want to have children naturally. I want to do things that I have to do. I am not on drugs or any of that. I want to live my own life. I am not going to allow anyone to put I do not want anyone to put a specific age limit on me. I do not want any limits or restrictions on me.
Okay.
And just let them know that this is one complaint and I plan to send others as necessary.
Perfect. Would you like the complaint number?
Yeah, what is that complaint number? Because I have a problem with how some of that stuff was written.
So that's going to be REQ.
REQ.
Dash GBD.
GVD.
Dash 24. 25. 57. 89.
Anything else?
No, ma'am. That's all. The whole complaint number.
REQ hyphen G or dash GVD dash 24255789.
Correct.
Did you submit that complaint already?
Yes, ma'am. It's been submitted.
What time did you submit that complaint at?
At 3:03 p.m.
Okay, and so is that okay? Because it's 2:03 p.m. here, so okay. And can you send me a copy of that complaint?
Yes, so a copy will be mailed out. Yes, ma'am.
Okay, and when would I look to get that copy of that complaint?
About 10 business days.
Okay. Now, I would also like to access all medical records on file that you all have for me as well. How can you send those out? I would like to put a request to get those sent out to me.
Alrighty. So, what is your mailing address?
Okay, you have one on file there as well.
And then in the form, you can go ahead and tell us all of the records that you will want, and then we will go ahead and send those out.
No, I want all of them, not any just info. I want all of them. So I would like to make that request.
The form needs to be filled out before we send them out. Yes, ma'am. So I went ahead and sent you the form, and you can expect that in 10 business days as well.
I have a call. If you can hold the phone or not, that's fine too. I have more questions. Okay. I appreciate you all staying on the phone, Anthem, Blue Cross and Blue Shield. Now I have some other questions about different things that you all services that you all provide, okay? Hello?
Yes, ma'am.
I have some questions about some different services that you all like cover as far as like what you would or not pay for. It's just some questions.
Go ahead.
Now, you all can you tell me the areas that you all cover with Blue Cross, Anthem Blue Cross and Blue Shield, please?
We cover the whole state, ma'am, of Wisconsin.
Okay, so what areas of specialty or like what benefits do you all cover?
We cover anything that's medically necessary.
And what would that be?
It just depends on what it is that you need.
So things like what? Medical? Do you cover mental? What we call mental health?
Yes, mental health. Anything that's medical, we cover. There's certain things that do need an authorization. Mental health does not need an authorization, but there's certain things that need an authorization, but that is more so of like DME. Some people need DME supplies. Some people need, let's see, what else?
Can you not abbreviate it though? Because I don't know what those abbreviations are.
Durable medical equipment.
You said that you cover everything medical?
Correct, as long as medically necessary. Yes, ma'am.
You cover chiropractics?
Let me verify that. One moment, please. So, chiropractor services are covered through the.
Right. So why did you say that you cover all That's why I asked you, what is it that you all cover?
So we cover anything that's medically necessary. We are still a state, a federal-based entity. Like the state gives you this health insurance. Sometimes we have vendors for different things, and at this point, chiropractor is through the state.
What is an entity?
A health insurance, ma'am.
Oh, okay. That's what you all call in the state of Wisconsin. An entity is health insurance. Hello?
Yes, ma'am.
I asked you, like, entity is health insurance, you said.
Yes, we're a health insurance plan. Yes, ma'am.
No, that's why I asked. That's why I said you said entity, and that's why I asked you to define entity.
Right. The health insurance plan. We are a health insurance plan. I called that an entity. Yes, ma'am.
And so that's what entity means?
That's what I called it. Yes, ma'am. Maybe I used the incorrect form.
Okay, so now you said you cover mental health. So if I want to schedule a competency evaluation, I want to make sure that is covered.
You would just need to find a provider in network. Yes, ma'am.
No, I would ask that I would see that you can make sure to validate that, because I want to make sure that you all cover that. A competency evaluation.
So we would need to get a provider, and then the provider gives that service. They will give us the CPT code, and then we could run it and make sure that it is a covered benefit.
No, but you all see, this is the problem that I'm having. No, I'm asking you, and that's what I said. You all know whether or not you cover something. So what's the department that could tell me and validate that or not? What is a CPT code? What is a
CPT? What CPT code they're going to use?
What is a CPT code?
That's a diagnostic code. It's called a CPT code. It's not short for anything. That's just what it's called.
But that has to be initials for something.
No, ma'am. It's just a CPT code. That's what it's called.
And you said it's a diagnostic code, right?
It's just a CPT code. Yes, ma'am.
What about transportation?
Give me 1 second. Let me verify that. All right, so it's covered by fee of service of needed non-emergency health care. Members can contact VEO for non-emergency medical transportation.
What about if someone is enrolled in school?
Alrighty, what about school?
Is that covered if someone is enrolled in school?
No, we don't cover anything that has to do with school. No, ma'am.
So you all want to claim that you're about health and providing health and mental health and vision and dental and transportation, but you don't make sure that someone can get back and forth to perhaps if they attend college or if they have a class that they need to attend or some kind of seminar or something like that.
Unfortunately, no. If it's a medical like office visit, then it would be transportation would be provided, but no, not anything school wise.
What about food, like for holistic? Do you have holistic and natural providers?
We should, yes ma'am. We should. I'm not sure, I've never looked for one, but I can assure that there is at least one provider in network that is holistic.
What about for natural?
We will have to research that, ma'am.
An alternative medications or rather, an alternative medicine.
Right, so like I said, we will have to research that.
Okay, well, how do you do that?
I can go ahead and do that right now. One moment.
I appreciate it.
Alrighty, so it doesn't seem like there is any holistic providers in network within the state, ma'am, for our health. That takes our health insurance.
Really? And
yes, ma'am.
So, do you know what holistic is? And do you have any?
No, ma'am, I don't. But then I did look it up on our.
Okay, what about natural?
Give me 1 second. So it doesn't seem to bring me any providers either.
And so that I would like to file a complaint about that as well, please. A separate complaint.
All right, give me 1 second. All All right, and what is the complaint going to be about?
The complaint, this is a different complaint, not to be mixed up with the previous complaint, that you all do not have any natural doctors or any natural physicians, and that you do not have any alternative medicine. I know, wait, you didn't say alternative medicine, and that you do not have any holistic. Now, I don't know if you have alternative medicine, but you do not have you have a severe prejudice, and you are discriminating as well against people, and you're forcing people to be in conjunction with a specific demographic.
Man, we gotta wait because I have to type all this down.
Go
again,
ahead. I'm sure I understand. I understand. Just tell me how much you can write and how soon you can write. I don't know what skills or tools you have.
I'm so sorry. Your call is going in and out.
You're writing down whatever. Just tell me when you're ready to hear more on what you have so far, please.
I don't have anything yet because I have to put what type of complaint it is and everything that I was working on. What do you want me to add, please?
Oh, so what is the options of what types of complaints you have? I didn't know that you could put a special or specific complaint title.
Well, it's just like, if it's about benefits, if it's about finding a provider, if it's about your ID card, it just depends on what it is that you're.
This is about Anthem, Blue Cross and Blue Shield, about you all as a business.
We can start typing whenever you're ready now.
So, okay, I'm just going to say this to you. I have a complaint that you all do not have any holistic doctors or physicians or anything close to that, specialists or whatever. That you also do not have any natural doctors or physician or anything like that.
Perfect. Alrighty.
That you are inflicting what could be punishments onto people, to forcing them into ways that may or may not be best for them, or even in particular.
I'm sorry, ma'am. What did you say about after punishment?
That you all are pushing people into.
We are all inflicting what could be punishment.
Yes. By pushing people into situations that they don't believe in, that may or may not be a good fit for them, or a healthy situation.
Okay.
You're showing a great deal of discrimination. Blue Cross and Blue Shield is showing a great deal of this demonstration. The state of Wisconsin is showing a great deal of discrimination to me, about me, concerning me, Jasmine Renee Davis.
All right.
You all are showing prejudice and violating civil rights, liberties, and perhaps freedoms. And other things.
Rights and what?
Civil freedoms, perhaps civil freedoms and civil liberties. And just me as an independent person.
Okay.
I do not know anything about being a member of Blue Cross and Blue Shield.
We added that in the...
No, I don't care. Don't tell, ma'am, listen, you are violating and abusing me. Write my report.
Okay, so what was that last sentence again?
I do not know anything about being a member of Blue Cross and Blue Shield. This is a total different situation, and I mean that. The fuck?
Being a member, not a member, you said to not call you a member. Would that be okay?
I told you that I do not know anything about being a member of Blue Cross and Blue Shield.
Blue Cross and Blue Shield. Okay.
I am not a member of you all, but please do not write my sentence for me. I know what I'm saying.
Right, so I'm taking it as you said, so that's why I asked, because I wasn't sure. I didn't want to, put something that wasn't correct.
When did you hear me? Where did you hear me say that I'm not a member? Where at? Where did you hear that from? When? What day?
You said you does not know anything about being a member of Blue Cross and Blue Shield.
Yeah, but you said you don't want to put a member because I said that I was not a member. Where you get that from?
The other complaint, you said you didn't want me to write member instead of, your name, so that's why I just wanted to verify.
Because I have a name.
Correct. That's why I wanted to verify, ma'am.
Okay. And so this is what I'm telling you. I am consistent in what I'm talking about, but I know what I want to put on this complaint. This has only to do about what I'm specifically saying.
I'm sorry?
I would like to write about this complaint right here.
Okay.
You all do not have any concern about anyone as a full person. I do not appreciate you all trying to separate me.
Yeah, you got to speak a little bit slower because I am typing all of this. About anyone as an individual person. Alrighty.
I do not like you all trying to separate me. I am a full person.
Us all to separate her. She is a fool. What after that, ma'am?
I'm a fool. I'm growing. And I want to make sure that you all aren't trying to put me into sections and divide me and take away from who I am. And because of the things that you all have, it shows that you are not appropriate in what you are saying.
All right, ma'am.
I believe that you all are false advertising. And it shows because of what information has been said to me that you all are false advertising and also having people automatically get into programs and not describe those things at all. And you do not have what people what people should have. If I'm my own person, I should be able to, you all should be able to cover somewhere where I can go instead of having to change who I am and change the DNA of my life or change the patterns of my life that make up me, the different things that I have to continue to be myself and grow and live.
So I just wanted to let you know that we follow Medicaid guidelines. We don't put these guidelines on our own. So it is directly what they advise us that we can and cannot cover. Okay, ma'am?
It does not matter. I still have a complaint, and that's what you all choose to do. You all choose to do it, and I have a complaint. You all, nobody is forcing you to do anything.
We just have to follow the guidelines.
Okay, and nobody is forcing you to do anything. And I already mentioned that this is about the state of Wisconsin. You are in the state of Wisconsin. Did you put that in there? I don't appreciate it. I did say that.
What you said about Wisconsin, yes, ma'am.
It does not matter. I do not appreciate the way that Blue Cross and Blue Shield handles. It does not matter. This is what I'm seeing from you. It does not matter. This is what you agreed to. You agreed to that, right? So it all matters. This is relevant information that I am saying.
Perfect.
I care too much about myself and my situation, and I'm not going to be forced into something that is inappropriate for my life.
Great. And is that all, ma'am?
You can put that you all are agreeing to guidelines that are inappropriate for function of me as an independent person.
We all are agreeing to guidelines. What was that? The next line?
You're being inappropriate. Okay? Your things are not appropriate for me as an independent person who wants to have control. I want to have full control. I want to have full control of my life. And it seems that you are not caring about me as a person. You are just treating me as if I am some kind of product. I am not livestock. I'm not some product that you are going to buy and sell. I do not agree for Blue Cross and Blue Shield to buy me or sell me. I do not agree for the state of Wisconsin to buy me and sell me. There are things that can be discussed. And if it's something that I do not want, I do not have to be forced. And I should have a choice whether or not of what I want to do with my life. The choices that I want to make for my life. And I demand the laws that you all are standing on, the guidelines, the principles, the policies, and the rules.
All right, ma'am. Anything else?
That you all use through Blue Cross and Blue Shield. You all seem to, you have transportation and you do not care about if people get education. You do not have any educational services or anything like that from what, I don't know if you do or not, but you are not caring about the full approach of someone, and you call yourself healthcare, mental health, vision and dental and transportation. And so this is not going to, this is just a separate and independent complaint.
This is not going to a separate independent?
This is not going to be combined with any other complaints. This is a separate and independent complaint. Make sure you write that, please. There should be alternatives in the approach of people to have.
I'm sorry, you're going out, ma'am. What was that again?
There should be alternatives. There should be other ways and places where I can go and I can get what I want for my life instead of being forced into the wishes or the traditions of others.
All right, ma'am. What else would you like me to
So
add?
that would be that complaint for now, and then you can tell me the complaint number and make sure that you submit that, please. And
REQ
I would like you to read that too, though. REQ
-GBD
GBD
-2425 6979.
Okay, REQ-GBD-2425-6979.
Correct.
Okay, so can you read me what you wrote, please, so I can read to me what you
I have to
wrote?
go back to it. One moment, please.
Just make sure I stay focused. No, wait a minute. I have to confirm this because someone else is writing it.
All right, so Jasmine and our Renee Davis is advised that we do not have any doctors, holistic or any natural doctors or physician or anything like that. We are inflicting that what could be punishment by pushing people into a situation that they do not believe in. That might or might not be a good fit for them or a healthy situation. Anthem Blue Cross Blue Shield in the state of Wisconsin is showing a great deal of discrimination to Jasmine Renee Davis about Jasmine Renee Davis and concerning Jasmine Renee Davis. We are showing prejudice and violating civil rights, freedom, and liberties. And Jasmine Renee Davis, as an independent person, does not know anything about being a member of Anthem Blue Cross Blue Shield. We do not have any concern about anyone as an individual person. Jasmine Renee Davis does not like us to separate her. She is a fool and is growing and wants to make sure we're not putting her into sections and dividing her and taking her from who she is. We do not.
Sure.
One moment. We do not. I'm so sorry. I just went away. Jasmine Renee Davis believes that we are false advertising, having people automatically get into programs that we do not have. We should have what people should have. Jasmine Renee Davis cares about herself and her situation and is not going to be forced into something that is inappropriate for her life. We are all agreeing to inappropriate guidelines and does not agree with Anthem Blue Cross Blue Shield or Wisconsin buying or selling her. The guidelines, the principles and policies and rules. I'm sorry, we have transportation and does not care about educational services.
Please, you're supposed to put laws. Laws.
I'm sorry, ma'am. One moment, please.
Yeah, it's supposed to say laws, guidelines, principles. Where you said guidelines, principle is rules, it's supposed to be laws, guidelines, principle, policy, and rules.
Alrighty. Let me just verify.
So while you edit that, I have a call that I have to handle here. I appreciate it. Hello, do you have the information appropriate now? Please.
Yes, I added laws. We have transportation but do not care about educational services. We do not care of the full approach of someone. This is not a confined complaint with another complaint. This is a separate and independent complaint. There should be alternatives of where she can go instead of being pushed into the wishes of others.
That is the start of what I said, and so you can submit that. Is there an updated complaint number since you did edit that?
No, ma'am, it's the same complaint number.
Okay, well, that would be all that I ask of you all right now. I have other questions. I have other things that I would like to have to be sent out. Also, can you send me proof of this doctor that you all have listed as my care provider, please, too?
What do you mean by proof, ma'am?
Like just a printout that you have. Who I need the paper, whatever says that I have this primary care provider and all that stuff. I need it to be printed out. You all have it there.
The card provides that, so I can send you a card.
I don't need a car. I don't want to carry around a car. I do not want to carry around any sort of thing associated with me with something that I do not have that is not valid. I'm not doing that.
Right, so the only thing that I can send for you, it's the card that will have the doctor's name on it, ma'am. I don't have a different paper that can send out to you, just a card.
So you mean to tell me that you all do not have any description as to anything about anybody? Like if someone asks, like, can you print out what you all have? Like as far as for any of these things?
No, ma'am.
I'll look into this further. You all can plan on another call from me sometime soon within the near future, of course. Okay.
Absolutely.
I'm Jasmine Renee Davis. I have some other stuff I have to tend to, but yeah, it's just OSSIRIS. I don't know exactly what you all are sure. I appreciate you for identifying yourself. That's appropriate. But yeah, I have a huge problem with this, especially where Medicaid and Forward Health is saying that you all have information, and you're saying they have the information. And so I just have some things, and I have to make some calls back and forth with you all soon this week, within perhaps 48 hours, okay? If you have any other questions, please, but make sure that you get my stuff mailed out to me. I appreciate it.
Perfect.
I'm Jasmine Renee Davis. So I have to come back on here so I'm on a live video. I have some stuff that I have to get to. I'm Jasmine Renee Davis. Today is, I put this date on here too. May 2025. It is 2:38. I'm Jasmine Renee Davis. Okay. I'm here. I'm Jasmine Renee Davis. This is most appropriate to make sure that I have my information here. I'm Jasmine Renee Davis.